Hi, my name is Kara Harwell, and I'm a nurse practitioner here at Nemours Children's Health. My background is in pediatric neurology and emergency medicine. I'm also certified as a pediatric mental health specialist. I've had the privilege of caring for children with sensory, developmental, and behavioral conditions over my time as a nurse practitioner. It became evident that hospital visits and appointments can be especially challenging for these patients and families. Because of this, through collaboration with Nemours Child Life Specialists, we created a program called REACH, which stands for Respecting Each Awesome Child Here. This program was designed to individualize care for these patients, improve their overall experience, and decrease escalations of anxiety and agitation. I'm honored to work with a team to support children with sensory, developmental, and behavioral needs and to help them thrive in these unfamiliar settings. For today's training agenda, we're going to review the background of the REACH program, the concepts of REACH, including awareness, communication, education, and environment. We're going to look at the REACH boxes, which include distractions and rewards. We're going to learn how to prepare for physical exam and procedures and review signs of escalation of anxiety and agitation. And then we're going to talk about how you can make a difference using this program. Now we're going to take a look at the REACH box, which is a sensory toolkit that you can use to help accommodate kids with sensory, developmental, or behavioral needs. You'll notice on the front of the box is the REACH logo, and it stands for Respecting Each Awesome Child Here. On the back of the box, you'll find a family questionnaire very similar to what's built in EPIC, as well as a menu of items that are in the box. The family questionnaire asks, how does your child communicate with you? How can we prevent your child from becoming anxious or upset? How does your child respond when they're anxious or upset? And what can we do to comfort your child? This section offers suggestions based on what the family told you comforts their child. So if they're sensitive to stimulation, you might offer noise-canceling headphones. If the patient benefits from chewing, there's chewy tubes, which we'll look at together. If they like tactile stimulation, there's a massager or sensory brushes. If they like toys that spin, there's a spinning toy. If they just need relaxation, there's a sound maker or noise maker in there that's calming. And then there's other distraction items. So now we're going to take a look at what's inside of the box. So simply take the lid off, and you'll notice on top here, these are items that the patient will use one time and they'll take it with them. So these do not need to be cleaned and returned to the box. So in this section, we have chewy tubes, which are helpful for kids that you notice are chewing on things, the medical equipment, their clothes, or biting on objects. You could offer a chewy tube here. These are actually really popular, and you'll find that you'll need to restock those often. These are sensory brushes, so these are meant for just calming of the patient, so you can brush this on their arm or on their lower leg. You should avoid their abdomen or central areas of the body. But these are often helpful for calming. In this section, these are called worry stones, and so these are for kids that are over age 3 that don't tend to put things in their mouth because we don't want them to choke on this. But essentially, it's a stone that they can kind of rub their finger over and bend and twist and just sort of play with throughout the visit, and then they can take it with them. In this section, this is more of a prize or reward section. So these are things that you can just give to the patient if you need to do a procedure. You can take one of these with you and use it as a distraction during and then give it to them or give it to them afterward. There's scratch and sniff stickers, little fidgets with marbles, stretchy tubes, and other just little fidgets and poppets in here. Looking in the bottom section of the box, this is the area where there's distractions that are meant for repeat use. So these will be wiped down with a purple wipe and allowed to dry and then put back into the box after the patients use them during the visit. So we have a motion bubble timer. A lot of times kids like to use this repetitively just to watch the bubbles. That keeps them calm, as well as other distraction items in here. There is noise canceling headphones, which are helpful if the area is loud or if the patient is sensitive to sounds. There's another bubble timer in here. There is the spinning toys that they all seem to enjoy. We have the noise maker, the sound maker, massager, caterpillar, fidgets, rainmaker, and a 3D pin art, which tends to be a favorite also. So when you're done with them, just clean them, put them back in the box. And you want to offer just 1 or 2 items at a time. You don't want to offer all of the things at one time, as that would be overwhelming and would be less helpful for distraction when you need it. The American Academy of Pediatrics suggests that the best practice for managing children with autism or similar conditions in the hospital setting includes prioritization of patient and family-centered care, environmental and sensory modifications, tailored communication, non-pharmacologic behavior management, and staff training. Some research findings from the REACH program initiation showed that training increases associate comfort level in caring for these patients, it improves patient and family experience, and it decreases the need for pharmacologic treatments and restraints. I want to share some feedback that we received from a mom at the initiation of the REACH program in the emergency room.
We met last night in the ER with my son Liam. I just wanted to say thank you so much for your help. You're amazing. I was positive that we were going to have to sedate Liam for him to get the medical care he needed, but we got through, and I'm so grateful. I cannot tell you how many times Liam's behaviors have resulted in him being forcibly restrained for medical procedures, and I'm so thankful for the kindness, patience, and compassion you showed us last night while we were at our worst. Liam does not take to people very often, but he likes you very much and is still talking about you today. I just wanted you to know you made a huge difference for us last night. Thank you for the work that you do. I know it must have been difficult, but you rock it. He was discharged today and is recuperating at home now. Thank you again.
The REACH concepts include awareness, communication, education, and environment. Awareness begins how we identify these patients when they arrive to our departments or our units. One way is through self-identification, using signage that patients can see when they walk onto the unit. The signs that we have available say, "Welcome to Nemours Children's Health, where we reach to make your visit the best possible experience." We realize that not all children process their environment in the same way, and we strive to meet the needs of all children. Please let us know if your child has any of the following conditions so we can best accommodate them during their visit. This includes sensory, developmental, or behavioral conditions. It lets them know that we have headphones to block noise and other sensory items available. Another way that we can identify these patients is through screening by our associates. In the EPIC environment, there's a question that populates that states, does the patient have any sensory or developmental needs? If the associate clicks yes, this will trigger a symbol that will populate on their patient list or on their care compass. This screening should be asked of all children who are 2 and up. As mentioned before, the symbol will populate on their trackboard, patient list, or care compass. Another way that this can be visualized is through a storyboard BPA. It also includes a hover feature where you can hover over the storyboard or the symbol, and it will show the responses to the family questionnaire, which we'll talk about soon. Another way that improves awareness of these patients on our units is to use a door hanger. These door hangers say reach at the top, and they say decrease stimulation, including sounds, lights, and touch, approach the patient calmly and smoothly, limit the number of associates in the room at one time, and see the patient's care team if any questions. When we are working to identify these patients, it's important to avoid implying that the child might have a condition if the parent denies any problems. you can still provide necessary accommodations without a diagnosis. Some parents may not want to say anything in front of their child about their diagnosis, and parents often do not consider these conditions as medical problems. So when you're obtaining their medical history, they may not mention that the patient is nonverbal or has autism or has speech delays or similar. And we know that children with autism, sensory issues, or similar conditions do not look or act a certain way. Regarding communication, we're going to talk about how we communicate with other associates, families, and patients. This is the questionnaire that we use across the system to individualize care for our patients. How does your child communicate? Are they nonverbal? Do they point? Do they use single words? What are the communication strategies that you use? Do they use a special communication device? What makes your child anxious or upset? When they are upset or anxious, how does your child respond? What comforts your child? In the past, what difficulties has your child had coping with medical experiences? Is there anything else you'd like to add that would be helpful to know about your child? This questionnaire is paramount to individualizing care for these families. When you're communicating with the patient, if the child is agitated or anxious, you want to give them space. Avoid talking or touching them. Let them acclimate to the environment first, and decrease stimulation overall. Speak directly to the patient, even if they're nonverbal. They do understand more, oftentimes, than what they can express. Keep your voice calm, minimize words and touch, avoid multi-step questions. You might have to wait for an answer as it could be delayed, and you definitely want to lower to the child's level, but might not get into their personal space. How do we adapt the environment to meet the patient's needs? You can create a sensory-friendly environment in any department that you work at Nemours Children's Health. You can adjust the lighting in the room. You can use a projector. Also be aware of alarms or harsh sounds, including monitors and machines. You can provide soft music using the music maker inside of the Reach box, or even the Blue Monkey Planet on the TV if that's available in your area. You want to consider the amount of people in the room at one time. Be aware of texture issues, the feel of the hospital gown, the ID band, the pulse ox. You might need to be creative to adjust for these. And be aware of noxious smells. In certain areas of Nemours Children's Health, you might find rooms that were already created to be sensory friendly. Even if you do not have access to these rooms or a Vecta machine that can make a room sensory friendly, as I mentioned, you can create the sensory friendly environment by adjusting the lighting and using a projector. Here are some other examples of what you might find in rooms at Nemours Children's Health. When you're preparing for physical exam and procedures, it's important that you introduce yourself to the patient and family and explain what you're going to be doing. You can observe the patient's behaviors before even talking or touching them, giving them time to adapt to you. It's helpful to inform them what's going to happen and in what order. You can utilize identified calming objects from the Reach box. You can use timers, counting, or statements such as first we will do this and next we will do this. One way to use a timer would be on your cell phone. And simply counting to 5 or any other number over and over again to let them know that the procedure will end at the end of that time limit. Give the patient choices. Allow the patient to touch the medical equipment. Beginning the exam with their hands or feet, then moving centrally, is often helpful to prevent defensiveness. You want to use your Reach box to provide rewards or incentives for desired behaviors. When you're planning for a procedure, it's very important to find out the patient's typical stress reaction, such as aggression, self-injury, or flight. Then you want to proceed to make a plan. You want to ensure that you have the right amount of associates in the room to help if needed. You want to prepare the environment to make it safe. You want to move in a coordinated fashion. And most importantly, you want to use one voice. One voice means that only one person is talking to the patient at a time. Oftentimes, patients can become overwhelmed by multiple people talking and attempting to calm them who have the best intentions, but overall, that might be overstimulating. And if you have Child Life in your area, consult them right away and include them in the preparation and throughout the procedure. There's times during procedures that you might have to change course. If the results are not clinically essential, and if you have insufficient staff or equipment, or if you're starting to see escalation of aggression or agitation, or if the associate or patient safety is in jeopardy, it is okay to have an open dialogue with the provider about the situation at hand and what could be done to accommodate. Signs of anxiety include an overall nervousness, restlessness, breathing faster or hyperventilating, tachycardia, running away, hiding, crying, maybe an increase in motor tics such as facial twitches, blinking, neck movements, or sometimes just repetitive questioning of the plan. Oftentimes you'll see that higher functioning children with autism might just simply start to ask over and over again what will happen and when, and that could be a sign of their anxiety building. Signs of agitation include irritability, anger, maybe their voice or sounds are getting louder. They're more aggressive, maybe hurting themselves or others. They might start throwing objects, biting, or even proceed into a severe tantrum. Some in-hospital resources that are available include Child Life, who you should contact early to help with assessment, patient coping, distraction, and setting up the environment. Social work can help with family resources and other care coordination. ERNIE resource is available when preventive efforts have failed and the patient is starting to escalate. A code BERT is when the patient's safety or associate safety is at risk and you need associates to help right away. The REACH program has always been supported by associates. This is a way that you can make a difference for kids with sensory, developmental, or behavioral challenges at Nemours. Through the Associate Giving Program, you can make a one-time donation to the REACH program, you can make recurrent donations through payroll deduction, or you can even sponsor a REACH box for your department. You can use this QR code to do that, and you can email us at reach@nemours.org to let us know if you've sponsored a REACH box, and we'll happily deliver it to your department and include the education that's needed, as well as signage and door hangers if that's what you prefer. If you have any questions about the REACH program, you can contact the Child Life Department, you can contact myself, or Kimberly Zalewski. You can also email reach@nemours.org.